Hi, this is Dr. Donald Pelto. I'm here to talk to you a little bit about some conditions that can happen in the nail salon. So this is specifically a nail salon handbook for people that work in a nail salon or work with problems with the foot and nail. And I'm going to go over some of the common nail and foot conditions that you may see. First of all, let's talk about a plantar wart. So a plantar wart is a wart that's in the bottom of the foot. It's caused by a papillomavirus. It's an infection in the foot. They're obtained usually because people go barefoot in different places. They often spread at showers or at gyms and places where people are barefoot. It may be treated with a number of methods, but recurrence is very, very common. Typically in our office we use a laser to treat ours. So here's an example of a wart here on the bottom. The main sign that you can tell it's a wart is these little black dots in here. Those are the pinpoint areas where the blood vessels come in. Here's an example of 3 different ones. And here's an example of a big wart. For an isolated wart like this, you could try to numb up the area of the foot and just remove it, but there's a high recurrence rate, so some of these other topical treatments are recommended. Let's talk next about calluses and corns. These are very commonly misdiagnosed as warts, so it's very important for you to know about these. These are thickened areas of skin caused by chronic rubbing and irritation. They're especially on bony prominences that happen when you rub on the ground or on the shoes. Very high areas of pressure can cause a callus that may be painful, especially in the center. There can be a little core in the center that can be painful, and these tend to come back quite a bit. So here's a couple of examples of calluses. Here's one on the side of the foot due to a bony prominence. Here's one on the little toe. And here's one we call a porokeratoma. It actually has a little circular lesion on there. And the main difference between a callus and a wart is that typically, going back to show you the previous pictures here, you can see that a wart, it does not have the skin going through it. So you can see how the skin lines, they stop and they go work their way around it. Whereas on a callus, many times the skin lines go right through the callus and you can see the skin line throughout it. So that's the main way to distinguish between a corn and a callus. Next, we'll talk about athlete's foot. This is a condition, it's called a fungal infection that happens on the skin. If it happens on the toenail, it's called onychomycosis or fungal toenail, but on the skin, it's called athlete's foot. You can pick it up at the gym, wherever you're walking, and it may occur anywhere on the foot, and it may burn or itch, especially it can happen between the toes, where they create little blisters. So here you see an example in the bottom of the foot. This is quite of a severe case. I would typically use a topical antifungal along possibly with a steroid. Here you see a little bit of skin sloughing. Between the toes you see how it's dangerous. This can sometimes create a cellulitis or a redness on the skin that would get an infection, and if the infection gets bad up here, it can be a problem. And here's some between the toes. The main difference in treating skin fungus is that if it's between the toes, you tend to want to use a gel. But if it's on the skin, not between the toes, you can use a cream. A gel tends to work the same way it works in your hair. When you put gel in your hair, it will evaporate the gel itself and just leave the product in there. Next, let's talk about ingrown toenails. These are toenails that grow into the skin. They commonly are caused by either a wide toenail or a tight shoe. They may be painful, it may be infected. The treatment is really to remove it, and sometimes antibiotics is needed. So here's an example of an ingrown toenail. You can see how it's red and irritated on the side of the toenail. This redness, this swelling, this irritation, all is painful. To treat this, we numb up the toe and we take out just this little section of the toenail to make this person feel better. As you can see here, if it happens over and over again, you can actually permanently remove the edge of the toenail. You go in, take out an edge of the nail, and you can put a product in there right around here where the nail grows from. It's called the matrix. You can either put a phenol or sodium hydroxide, and then what happens when the toenail grows back, it's not as wide. Let's talk a little bit about fungal toenails. These are thickening of the toenail caused by fungus. It may be caused by injury as well. And it tends to progress, meaning it starts on one toenail and it can move to the other toenails with time. It may be found with athlete's foot as well. So here's some example of toenail fungus. Here's a superficial white onychomycosis or nail fungus. Sometimes this can be treated with just a topical nail fungus, such as a nail polish type of fungus. Here's more of a thickly involved nail. And these little fifth toenails, they tend to be affected quite a bit. And they're hard to treat because they rub on the sneaker and they make them more susceptible to getting a nail fungus. Here's an example of someone that had a nail procedure actually because the toenail caused some pain for them. The typical treatment is usually after 3 treatments. It can be either a topical, which is effective about 20% of the time. It tends to work better on a nail fungus like this that is a little bit this white superficial. And then there are the oral pills, which tend to work better on the real thick ones. And then there's laser treatment for fungal toenails as well. And they tend to be really challenging to treat, and there's a high recurrence rate. So sometimes you need to use such as a steri shoe or some other type of technology. Nail injury, these you'll commonly see if you're treating people for pedicures. They have blood underneath the toenail caused by some type of injury. So here you can see there's an area of a blood blister underneath here. You don't need to drain it unless it's painful or unless it involves a big portion of the toenail. So this one's not painful. Nothing is needed to be done. A lot of times if it's very, very loosened, we can actually trim back this portion of the nail and just remove it and let it grow out. And here you can see the areas of injury that this patient had. And as it's growing out, you can see it distinctly. You're able to tell where their injury happened. For these types of conditions, you just let the toenail grow out and eventually look normal, hopefully. Sometimes that injury can cause some thickening of the toenails as well. Eczema. Eczema is an inflammation condition of the skin. Sometimes can cause some redness or itching, and it may be chronic in nature, and really the treatments depend. Here's some really, really bad eczema you can see on the bottom of the heel. This is eczema mixed with callousing, and you can see there's a little opening, almost of a sore on the tips. So treatment for this is typically a urea-based cream or even a steroid cream as well. Hallux valgus, or a bunion deformity. This is a structural deformity of the bones where they spread on the top of the foot. Here's kind of a bunion you can see on the side of the foot, and also some curved toes. These can be treated with wider shoes, with padding, and eventually surgical treatment as well. This is an example of a pin K-wire fixation where we cut the bone, shift it over, and hold the bone into place. This is something you may see patients come in with this type of a surgery. Here's an example of quite a severe bunion. This type of a bunion may need a surgery, may more down towards the base. You can see here on the x-rays, what happens is there's a little sesamoid. These are two little bones that are typically underneath the head. This is the head of the bone, and this head should be over here, over the top of these two bones. So this is what we call a dislocated or a sesamoid bone that's in the improper position. Here's a condition where we actually did a base osteotomy, or a closing at the base there. A Tailor's bunion is another bunion deformity, but on the outside of the foot. It can be painful as well, and surgery may be needed. Here you can see one on the outside, where it typically is a woman or a man that has a very wide foot. So they may have a Tailor's bunion on the outside and a regular bunion on the inside, and this can be painful for them, and the treatment is just kind of shaving down that bone there. You can also put a K-wire in there and hold it in place with a wire, or it may just be enough just to trim that bone. A hammertoe is actually a contracture of the toes. They may be flexible or rigid. The main way to tell that is if it's flexible or rigid is if you can straighten it with your toes. For example, if you can straighten these with your toes, they're more flexible, and they tend to be treated better with just cutting the tendon on the bottom. But if they're more rigid, you'll have to actually remove a portion or a section of the bone here to treat it. Here's an example before and after. This is a little hammertoe on the tip of the toe. Once again, it's straightened out just with doing an incision there and straightening out the toe. Hallux rigidus, this is arthritis of the big toe joint. It causes restricted motion. It may be painful, especially with repetitive motion, especially with kneeling or squatting positions. So here you can see the big toe joint. Here's a big spur on the top of it. That's what it looks like on the x-ray. Here's the actual joint mouse inside of the joint. That can be painful. These can be trimmed down or removed. Treatment may as well be needed to have a fusion where we actually cross some wires or some screws to hold it. You can note the joint space narrowing and the spur formation on the margins. Here's the margins of the joint. Another condition you may see is rheumatoid arthritis, so that can show up in the hands and the feet. It tends to be an inherited arthritis around the joints. There's joint destruction, and people may be predisposed to bunions or hammertoes. So here's an example. You can see a rheumatoid nodule down here. This is a soft tissue mass, and also bunions and hammertoes. These can happen with people with rheumatoid arthritis, but it can be other people as well. Gout is a buildup of in the blood and tissue of uric acid. It tends to rise up with certain foods such as red meat, seafood, and some types of nuts. It may be triggered by dehydration, and it tends to attack the big toe joint. And people have severe pain. There are a lot of different medications you can take, sometimes an injection is needed, but the hallmark is redness and swelling around the big toe joint, and that needs to be treated by a professional. High arched or pes cavus. This is a condition that usually happens with neurological conditions such as polio, MS, or cerebral palsy. It may cause pain to the Achilles tendon or also to the ball of the foot, because if you have a really high arch here, people put more pressure on the ball of the foot and also more pressure to the Achilles tendon. Here's how someone that's standing. You see how they stand more on the outside of their foot because their arch is really, really high. Flat feet, once again, this is another condition where the structurally lower arches and may be painful in the ankles and the knees and the back, especially when they flatten out so much. So here's an example of a flat foot. You can see there's really no arch on this foot, and the back of the heel goes outward. So someone that has a real flat foot, they may need orthotics, they may need surgery. They'll definitely need some really good shoes to support their feet. Plantar Fasciitis, heel spur syndrome. This is really an epidemic these days. What people present with is an inflammation or tearing of the ligament on the band of the plantar fascia. It may be torn, it may just be inflamed. It can be caused by a poor arch, but usually it's caused, it may also have a spur, but usually it's caused by a tight Achilles tendon. So the plantar fascia is right down here, and the Achilles tendon in the back of the calf is very, very tight. And so it's a problem with movement. It's a movement disorder that can cause this problem. An ankle sprain, so someone may complain of swelling in their ankles or an ankle injury. This is usually caused by some type of a twisting, and they tend to be swollen on the outside or the inside of the ankle. A Morton's neuroma is a compressed nerve between the third and fourth toes, very, very common, and may be painful for people. So you can see here there's a enlarged nerve in this area that may need to be injected with cortisone. It may be surgically removed as well. Going on to talk about a Haglund's deformity, this is a big prominence in the back of the heel. It can be irritated by shoes. We usually call it a pump bump. It can be caused by, made worse with a tight Achilles tendon. There's different types of treatments. Usually you want to avoid wearing a shoe that will irritate it, such as a shoe that's going to rub back here. You can sometimes try stretching exercises or something to loosen up the calf muscle, but eventually surgery may be needed to remove that bump. We'll talk now about ulcers. Ulcers are wounds or sores. They typically are found in people with poor blood flow or poor sensation. And here's an example of one that's due to poor circulation. They don't have enough blood flow to heal it. Maybe it started as a callus, but there's a big deep hole in the side of the foot that needs to be treated, and it may need to be treated in team with a vascular surgeon to help get some blood flow back to the area. Here's a patient that already had an amputation. Now they have an ulcer down here. That's a diabetic ulcer. It may start as a callus, but then it kind of gets bigger and bigger and opens up and creates a sore. And once a person has an amputation of one big toe or any part of their body, they're at greater risk of having another one. Ganglion cyst, this is a little soft tissue mass that can usually arise from a tendon lining or a joint. It tends to be gelatinous. So here's an example of one from this joint area right here where it kind of grows out. And here, this is maybe the joint or maybe a tendon over here. That can be treated by drying out the liquid and putting a cortisone in there with compression or surgically removing it. But when you remove it, you have to be careful because there's a high rate of recurrence. A subungual exostosis is a bone and cartilage problem that usually happens anywhere, but if it happens under the subungual, means under the toenail. So here's the toenail with a big bump there, and that's the example of a bone spur. That can be trimmed down and removed and help people. Venous stasis, this is discoloration of the skin due to swelling of the legs. It may cause breakdown of the skin. The treatment typically is compression and elevation of the legs. Sometimes we use something called a uniboot to put greater compression around here to help this venous stasis changes in the leg. And also fissuring or cracking of the heel. In the back of the heel, they can have cracking right here using a really, really dry, really good cream here. I don't recommend a lotion. A lotion is more for skin. For the dried cracks area is a urea-based cream. And then we also treat different types of fractures. You may or may not see these, but just to show you, there's a toe fracture right here. This is a fracture of the navicular bone, the calcaneus or the heel, and then the outside, the fifth metatarsal. Hyperhydrosis is excess perspiration that may be caused by stress or an overactive sweat gland. There are some topical medications, but if someone sweats a lot, they may need treatment. You have to ask them, is it sweating just in the feet, or do they have it in their armpits as well and other places of their body? That sometimes can be treated. Achilles tendonitis as well this is a very challenging condition to treat because it may just keep coming back and back and back, causes swelling in the back of the heel, right in the area of the Achilles. You have to be careful that it's not a rupture of the Achilles tendon and just a inflammation. Treatment can be done with physical therapy, anti-inflammatories, and sometimes orthotics are necessary. So if you found this helpful, you can learn more here at drpelto.com. That's where I put more information. The main thing you want to look at is a foot pain toolkit. Pretty much everything I talked about, it's talked about in more detail here at this foot pain toolkit. And also there's a toenail fungus report around there too with information on nail fungus. Okay, hope this is helpful. If you have any questions, you can email me at don@centralmasspodiatry.com.